Okay, let's begin. Uh, Exercise for perioperative period. How I say you, how it's be. Um, okay. First case clinical. 6 days after surgery, the patient had pain in the wound area, red swelling, pain, and increased body temperature to 38. Uh, At first, I want to say that this picture is not a picture of this clinical case. It's In this picture you need know on the wound, you need to see on the wound, yes, and the complication. What is in this case? It's the same complication. Okay, you need define the nature of the complication and specify the actions. Okay, it is a first clinical case. You can write now in your textbook or in your copybook first clinical case, what you mean, what is it, and how you will help your patient. The second case, 8 hours after surgery, cholecystectomy, the patient shows sharp weakness, dizziness, thirst, skin pale, pulse frequent, weak feeling, AD 9060, hemorrhagic liquid is in drainage. Uh, Look, what you need in this case, you need to determine the complication and indicate the actions of the doctor. Look, what is important in the case? Uh, Hemorrhage, liquid in drainage. Yes, there is drainage. There is, yes, and there we see hemorrhagic liquid. Uh, Thinking what the complication is there and how you need help your patient. Third case. Patient 28 years old entered the surgical department about acute appendicitis. Appendectomy was performed, gangrenous for-like process was removed. The operation took place with technical difficulties in view of the retrocecal location of the process and the presence of a moderate infiltration. So a drainage tube was delivered to the right lateral channel to the site of the operation. Observed in the intensive care unit, he observed in the intensive care unit. 1 hour later, after he started to observe, the surgeon on duty 24 hours in hospital, remember, drew attention to the pale skin, tachycardia, pulse rate 110 per 1 minute, AD 160, up to 30 milliliters of blood supplied by drainage was found in the container. The patient started a drip infusion of aminocapronic acid. Sodium ethoxylate was introduced. After 20 minutes, the condition of the patient didn't improve. Tachycardia reached to 120 per 1 minute. Okay, there you need uh, what is important there. Um, Right lateral channel the site operation, we have a drainage, and there we can see what we see, nothing. To the right lateral panel, to the site of the operation. Observed intensive care unit, up. What? 30 minutes of blood supplied by drainage. Okay. What complication did patient develop in the early postoperative period, and what is your tactics? Next condition. Um, the patient, 68 years old, is operated on emergency indications about acute cholecystitis, choledocholitiasis, cholangitis, mechanical jaundice. After the surgery, she was transferred to the intensive care unit. After 20 minutes, respiratory depression developed. Clinical symptoms: rare superficial breathing, tone intake, blue face skin. What is the complication of the early postoperative period in the patient and the possible causes of it? What measures should be taken to eliminate the complications that have developed? Next clinical case. I forgot what is the number of it. 1, 2, 3, 4, 5. Okay, 5 case. 80 years patient was operated on about right hand inguinal scrotum hernia. Within 24 hours, the patient could not wash, could not urinate on his own, despite permission to make the attempt while standing at bed. What complication did the patient develop? Can you give me his possible reasons? Mm, what possible reasons? What complication developed? And what activities will you carry out to eliminate this complication? And the last condition, I think. The patient, 32 years old, is operated on emergency indications about acute reflux appendicitis. The appendectomy is made. The appendectomy is made. The postoperative wound was not drained. On the third day, the patient's body temperature increased to 33, 38, 9 degrees, and pain in the wound area increased. Despite pain relief, on dressing, skin in the area of sutures is normal color, but when palpating long wounds, the seal infiltration of tissue is determined. What complication developed? What actions will you take to help people, to help patient? Okay, now stopping. Write in comments your answers. Yes, 1, 2, 3, 4, 5, 6. Then now look. Now you need to stop this video. Yes, tap pause. Then after you commenting this video with 6 answers, um, write right. Tap play and watching answers. Now please stop the video. Stop. 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 Couldn't stop. Stop. Okay. You stop. Play. Let's go and see answers. Answer for first case. If you remember, it is this one. First answers. There was wound suppuration. Yes, suppuration diseases. It is necessary to remove sutures, open the wound, remove the pus, and further treat the purulent wound. Purulent wound. Yeah. Okay. Next one. Next one is yes, this case, and it is a bleeding, internal bleeding. Так, я немножко потерялся. Okay, the patient has internal bleeding. You need to do emergency surgery, like rail laparotomy and stopping bleeding, or rail laparoscopy. What kind of operation you can choose. Next one. It is this one. Yes. Yes. So in SOT we talk about complications like bleeding, and we need to do laparotomy, and then we need to do a hemotransfusion. Okay. Next one cases, it is this one cases, yes, this one. The respiratory depression in an operated patient can be due to the depressive effect of narcotic substances on breathing and blood circulation, vomiting and regurgitation, language loss, which can lead to mechanical asphyxiation. Okay, and not the last one, but number 5. Yes. Oh no. 1, 2, 3, 4, 5. Yes, this one. 5. Okay. 5. What is 5? The patient developed acute urinary delay after surgery. It's not a normal situation, but it is a early complication, and it can be. Uh, and you need to answer what disorders um, can develop to this complication. Cystitis, urethritis, pyelonephritis, and other inflammatory diseases. Uh, okay, next one. Next one is this one, yes, and I think you understood that it is separative diseases, and wound is infection, yes, inflamed wound, and you need remove sutures from the skin and make a revision, find a cavity, take away all pus, um, pus, uh, and then do a secondary debridement, yes, and um, use medicaments to healing a wound. Okay, that's all. Thank you very much. Have a nice day. Be healthy. Bye bye.